great part about standing in front of Dan.
Oh yeah, where is Dan?
In the back row.
Dan's usually over here.
What's mine? I got to buy a razor? I got my neck. Oh, it looks good.
I want to welcome everybody here this afternoon for an important announcement on a very important piece of legislation, on a very, very important topic that our colleagues across the aisle, our governor, would like to pretend never happened. Recently, we had the new Commissioner of Health, Dr. Bassett, at her confirmation hearings, essentially said, I've never looked at the memorandum signed by Governor Cuomo directing COVID-positive patients into nursing homes. I have no interest in looking at the memorandum or revisiting this issue. It's probably very inconvenient for her and her boss, but I can tell you it's not nearly as inconvenient as the deaths of the 15,000 people that occurred in this state in direct part of that order. Those families never received an apology. No one's ever been held accountable. They were told, who cares, by the last governor. Well, I know two people who care. My conference, the 15,000 families, but two people who are here with me today, Senator Sue Serino and Senator Jim Tedisco. They were talking about this issue when no one else was. They were calling for an accountability, for an investigation, when no one else was. And they haven't forgotten those families. They haven't forgotten the seniors who died. They haven't forgotten that no one's been held accountable. And while it's inconvenient for our colleagues across the aisle to talk about it, my colleagues, Senator Serino, Senator Tedisco, and our entire conference, we know we have to talk about it. We have a duty and a responsibility to get to the bottom, to get an answer out of this administration, and to compel them, if they are unwilling to voluntarily do the right thing. And so at this time, I want to call up a champion on this, our ranker on the Aging Committee, Senator Sue Serino.
Thank you, Leader. And I just want to say a personal thank you to all of the media here today. You all know that this is something that I care deeply about, that we all do. 15,000 plus New Yorkers lost their lives to COVID-19 in nursing homes during the pandemic. That's 15,000 plus families impacted. Families who are looking for answers, accountability, and a better path forward so that no other family has to ever suffer the way that theirs have. I came into this year with high hopes that we would hear from a new administration, a new health commissioner, with the desire to right the wrongs of the past. Instead, Dr. Bassett showed a complete disregard for these 15,000 plus New Yorkers when she said during her recent confirmation hearings that she will not look back, or in her words, unraveled what happened with the former administration. That is totally unacceptable. Too many New York families who were impacted by the state's horrible pandemic policies don't get the luxury of not looking back. Too many of them spend each and every day trying to unravel exactly what happened to their loved ones. And let me be clear, we all of us here share the desire to move forward. But in order to do that effectively, like all scientists know, we have a duty to evaluate and learn from past practices. That's why today we are introducing legislation to compel Dr. Bassett to do just that. Our bill would require the Department of Health to conduct an investigation of the prior administration pandemic policies as they specifically relate to nursing homes, and a re-audit of the number of COVID deaths in these facilities. The bill would require Department of Health to release a public report to provide answers to loved ones and lawmakers alike about how and why decisions were made and how they may have impacted the health and the safety of these vulnerable residents, and create an action plan to prevent this kind of tragedy from ever happening again. Less than 24 hours from now, Dr. Bassett will appear before us at the budget hearing, the health budget hearing on health and Medicaid. We plan to ask her about this, and I sincerely hope her answer has changed. If it hasn't, Governor Huckle must make good on promises that she made to the grieving families by including this language in her 30-day budget amendment. This push isn't about living in the past. It's about ensuring the health and safety of vulnerable New Yorkers now and in the future. Now is precisely the time to unravel the truth. Thank you, and with that, I introduce my colleague, Senator Tedesco.
Thank you. Thank you, Senator Serino. Very well put. And I want to thank you and our leader, Senator Ort, but I really want to thank all of my colleagues behind me, because I think Senator Ort said it right. Every single one of the men and women behind myself and Senator Serino were fighting and standing up for their most vulnerable population during the last 2 years, fighting to give some understanding to all of the leadership here, including the governor, Commissioner Zucker, and everybody who wasn't seemingly using common sense, putting contagious individuals with a very serious virus as it relates to the elderly populations, those who are compromised, those who are in nursing homes. And let me make something perfectly clear here. We're not talking about going backwards. We're talking about going forward with this particular proposal for a full investigation, and then a plan and a group of recommendations of how we do the best practices that were in place and the failures that were put in place. That's what this is all about. We want someone at DOH, and who better than the new commissioner, to go in there to sit down with some of the staff people who are still there and do a full investigation, because some of those people were in the room when this all took place. It certainly wasn't just Commissioner Zucker and this governor who said we're going to lack total common sense, and we're going to say people who had this serious contagion, which spreads, which maybe it doesn't impact young people, but has a profound and serious impact on the elderly and those who are being cared for in nursing homes, immunity-compromised individuals. And I think Senator Ort said it right. At one point he said, they died. What difference does it make? And you know what? When somebody dies in a hospital, that's a hospital death. It's not a nursing home death. You know what that's like saying? I'm in a nursing home. You send somebody in there who has the contagion. I get it, and I'm so sick I have to go to a hospital. The ambulance picks me up, and I die in the ambulance. Well, that's an ambulance death. It's not, no. To the one extent, he was right. It does make a difference, though, where the contagion takes place, not where they die necessarily. They could have got it in a nursing home, went home and died. They could have got it in a nursing home and died in an ambulance or in a hospital. That was the important thing, to match up the dates. In March 25th, it took 4, 5, or 6 weeks before when we were telling them, hey, this isn't working, and it wasn't working to begin with. I don't know if you saw the governor's first press conference or remember it. In his first press conference, he came out there and said, we're New York strong. We've been preparing for a virus like this for years. We're prepared for this virus. He was not prepared for this virus. But in all deference to him, no state in this nation was prepared for this virus. The world was not prepared for this virus. But you don't have to prepare for common sense. Common sense would dictate a serious virus that can spread rapidly and move around like a chameleon from Delta to Omicron to we don't know what the next virus is going to be potentially. If it ends now where we can go out and this is like the flu, and I think it's getting close to that, there's a potential for a more serious virus to come. We have to look at the past to see what the mistakes were made, not do those again. See what we did right and enhance on those actions that did it right. What's better than a whole new administration, a new Department of Health commissioner to do the investigation that we have been calling for by an outside independent group? But this is the group which dealt with that for a whole series of time. And Sue is absolutely right. I asked a question. I started out with this. Commissioner, it's been said, and Winston Churchill, I guess, said it, I don't know who actually said it, if you don't recognize what happened in history, you're destined to repeat it. That's the good things, and the bad things are going to take place. Could I ask you, what lesson have you learned from past history and the actions, talking about the March 25th executive order and other actions taking place with DOH? What have you learned? You know what she said, and Sue said it? basically she was saying they didn't learn anything. She said, first of all, I'm not going to go read, and I haven't read the executive order. That is unbelievable. When I heard that, that was shocking. And then she said, as has been said, I'm not going to go back and find out what went wrong. I'm not going to unravel it. I'm going to go forward. How can you possibly go forward if you're afraid to go back, go into that DOH, talk to some of the individuals who are in there, do a full investigation? If you have to use subpoena power, use it, and come back with a report to us in 90 days of what you found out about that executive order and about other elements which may have related to this virus spreading like it is to our most vulnerable population. Now, you know the governor had a whole bunch of other people who caused this whole thing. First of all was the previous president, then it was CDC, then it was the nursing homes itself, then it was the staff of the nursing homes, then there were deaths in hospitals, so it could have been a hospital problem. But he never took any responsibility. But what he did do is write a wonderful book. He said it was an autobiography. You know what it was? It was a piece of fiction. And you know it was a piece of fiction with lies and distortions. And then he used our tax dollars with his staff to actually write the book. He called himself basically a COVID virus slayer. He was a COVID virus purveyor. He helped spread the disease. I firmly believe that. Now, to what extent? We don't fully know. Should we fully know to the best of our ability? Absolutely. Dr. Bassett, Commissioner Bassett, we're asking you today to do your due diligence. Do the right thing. What is the harm in going back and finding out what we did right and what we did wrong? But to suggest I'm just going forward, how is that possible? How is that possible? We don't know what's going to be in front of us. Listen, I hate to say this, it's like those 100-year storms. This is probably going to happen again. And here's what I want to know from her and her plan. I want to see that plan in 90 days. The governor said initially, I don't know if you remember this, the reason why we have to put these people back in the nursing homes, even though they're feeling pretty good, but they still represent they're contagious, we can't discriminate. Just because a person has a contagious disease, you can't. Well, the people who were discriminated against are the ones in the nursing home who were basically healthy, but elderly and compromised to a little bit. That's what this governor said. So what we need to do now is have a plan when so many beds are being utilized and the beds are being full. That may really happen someday. We may really have a virus that we can't control. That is not like Omicron, which is contagious but not necessarily as harmful, but it's at such a high level, it is killing a lot of people. But it may be at a high level of contagion and a high level of having impact health-wise and taking people's lives. Where are we going to put these individuals who come from a nursing home, who get sick, or who are elderly or about to go into nursing home, who fight their way through it in a hospital, a healthcare facility, get better, and now we're losing beds, and we got to do something with them because they're not actually sick, but they could spread the disease. Where are we going to put them? Port, they never used that boat. Javits, they never used that. We need places throughout the state of New York. Maybe we have to deal with commercial individuals that say, will you be prepared to give us a facility? We've got the beds packed away. We've got the ventilators packed away. We've got the masks packed away. We're ready for anything that comes at us, and we're ready to where we're going to put these most vulnerable people. I don't see that plan right now, because it probably could and very well may happen. And I want to know they're not going to go back into a nursing home. And you know who else wants to know? The family members. I know the leader, and Sue didn't mention this, but we have another bill. You may have seen it in the release we made. And that is to commemorate March 25th as the day where we remember the most vulnerable population who lost their lives due to, I think, some actions that were taking place by the state and probably other actions that were taking place. But the family members deserve that. They deserve to know we're not going to forget them, because I'm contacted with them a lot, over and over again. Hey, this is not over with. A lot of people lost their lives. We want to know why, and we want them to be remembered, and we want to know that the families have the opportunity to understand every year 15,000 lives. We have a 9/11 commemoration, and we should, for the 3,000 people who lost their lives. For 15,000 of our most vulnerable populations, we should have a commemoration day. So there's two bills here, one for that particular day. We have days for everything, okay? We definitely should have a day for those 15,000 individuals who lost their lives, and an investigation, and I want to know, and we want to know what the plan is, so we can go back to our constituents and say, this is what's going to happen. If, God forbid, something happens with a lot of our seniors, and they have to go someplace other than a hospital, we want to know where we're geared up to do something different than we did with that March 25th executive order. So thank you very much.
And now we have Senator Barillo. Sorry.
Thank you very much. First of all, I want to say thank you very much, Senator Tedisco. You're a champion on this and have been. Especially want to thank Senator Serino. Being the Aging Committee Chair, you have really brought the fight to them. But I think it's pretty sad because what has occurred? What has occurred is the public trust was broken. And the separation of powers between the executive and legislative was compromised. And what was the answer when we were in the Aging Committee? When we presented amendments to say we are going to force subpoenas. We want to bring the folks responsible for this in front of the Aging Committee and ask them what happened. What did you know? When did you know it? And what did the chairwoman of the Aging Committee say? No, that's not our fight. We're going to leave that to the executive branch. And now, Dr. Bassett, the new health director, has said, it's not my fight either. We're just going to move forward with blinders on and not see what's actually happened so we can prevent it from happening again. So they have failed in their duty also. Dr. Bassett has already said that, and the governor has backed her up. That's why this piece of legislation is so critically important. We need to force this to happen. The legislature needs to step forward once again, reassert ourselves as an independent member of this government, to hold them accountable. Because it's not going to happen on their own. They want to wash this over. It was shameful what was said in those Aging Committee hearings when we brought up the idea of issuing subpoenas. It was shameful that they really just kind of laughed it off in a way. Because they were hopeful that our executive branch would do something about it. Ladies and gentlemen, that's not happening. And we need to make this move forward as quickly as possible. We need those answers for the families who have been devastated by the losses of their loved ones, and the people of New York State who have lost faith in their government. So I appreciate all of you being here, and certainly, again, appreciate all that you have done and all that my colleagues have done to stand up for the vulnerable seniors in New York State. Thank you very much.
Thank you.
Take it back to you, Senator Tedisco.
Yeah. We'll take some questions now, but I just want to say one last thing. We were begging to get these answers, as the senator, myself, and Senator Barillo, and all my colleagues said. It took 9 months to get the transparency necessary. After the AG said it was a 50% undercount, Judge Kimberly O'Connor, the Empire Center, I became an amicus brief with them, and we sued the governor of the state of New York. Do you remember what Judge Kimberly O'Connor said? He broke and he violated the open government law, the FOIA law. He had to give us the numbers. Now, they gave us some numbers, but also, you know what he had to do? He had to pay the legal fees. He didn't pay the legal fees. You know why? He was indemnified. You know who paid the legal fees? The families of those who lost their lives in the 19.5 million people. They paid the legal fees when we sued to try to get those numbers. So we say to Commissioner Bassett, we need transparency. That's what we're calling for here today. What happened, to the best of your knowledge, to your best of your ability? You're in the inside. You can talk to the people who were in those rooms. They may not have been the commissioner, they may not have been the governor, but they were listening. What was the mindset to lack that common sense to do something like that? And we need the transparency to make that happen.
So about a year ago, we were having a very similar version of this conversation, and I don't know who the person is to answer this, but at the time, the apex of justice for the conference was to have either Zucker removed or to have him resign. Now, most of this, well, just about all of it, happened under his tenure. So what does the new version of justice as it relates to Howard Zucker specifically look like now that he's no longer running the Department of Health?
Well, meet the new boss, same as the old boss to a certain extent. Okay, now she's not, I appreciate the fact at the end, she said, well, if I'm forced to do something that's not in the best interest of my constituents, I'll say no or I'll resign. Well, that's nice and it's easy to say, but you haven't been faced with that like Commissioner Zucker was faced. And by the way, the New York Times was reporting, and I read a lot of those reports, that the governor was calling out and saying, we follow the science. This is the science on that issue. Then he'd go back to DOH and the people who know the science and say, I want you to tell them this. And they said, we can't tell them that. That's not the science. And many resigned. Okay? So what we want her to do is go back to those people who said that's not the science and get the information from them of what they felt about what the governor was telling them and actually what the science was and the ramifications of them wanting to leave and them not wanting to follow the things he said with the science. Because, listen, a fourth grader doesn't have to prepare to know that if you have a serious disease that's contagious, you don't go running around people who are most compromised and most literally affected by that and could lose their life and did. So
for Howard Zucker, in theory, to be at tomorrow's hearing, and would you say that the punishment phase, now that he's gone, is over for him, the individual?
No, I wouldn't say that. If he was enabling, and there's some inside people who say, well, this is what they were talking about, if there were political ramifications, if there are reasons why they lied and withheld because they knew they were doing the wrong thing, and the wrong thing came to bite them back, and there was scheming, you know, we just need to know, okay? And I think the AG report says a lot about what took place, because 50% undercount, suggesting that these are hospital deaths. That defies logic. When you get a contagion somewhere that can kill you, and a hospital tries to save you, and you say, well, a hospital caused that death. No. Where the contagion took place is what counts.
Sorry. And you know what, Darrell? It's really about answers for these families. That's what they want. And if there was something illegal done, then you know what? Everybody should be held accountable that did it. And as all of you know, I know I had spoken to the health commissioner. We had an idea for specialty care centers, step-down units, totally ignored. It wasn't until months later that they actually did something. So look at all of those families that were lost. But we don't want to make the same mistake going forward. You know, whenever there's a tragedy, airplane crash, whatever it is, there's a deep dive into an investigation, and that has not happened here, and that's what these families want. You know, they met with the governor in October. I'm sure you saw it, you know, so the governor had stated, and I can't quote her per se, but she said, you know, 50 years from now, we need to know what went wrong. Well, the only way we're really all going to know what went wrong is if this happens, this audit, and that's why we put it into a bill. So I thank you for being here today, too.
One of the things that Hochul said when she first came in was that she was going to have the most transparent administration that New York has known. Do you think that she's being hypocritical, or health commissioners by default, the administration being hypocritical by not doing an investigation of the prior administration?
I feel that an investigation should happen. I don't know if you know, the health commissioner was brand new, but I think she owes it to these families, and the governor does as well. She said she was going to be transparent. She made that statement, and we've all seen it, and that needs to happen. So tomorrow we will be talking to the health commissioner and asking her these questions once again. And like I said on the floor, I hope she finds it in her heart to do the right thing for these families, because that's what they deserve.
In relationship to that, there's an old saying, the buck stops here. The buck really stops with Andrew Cuomo. The buck stops with Governor Hochul, okay? I'm surprised that she hasn't asked for an investigation. She's not looking back so we can go forward. She's not looking at history so it doesn't repeat itself by not asking Commissioner Bassett to do this full investigation. So truthfully, the buck stops with her, but I think the commissioner also has the opportunity to have the buck stop with her, because she has the ability, I think, to do that investigation itself, or a review, anything she wants to call it. And we're asking for her to do that, give it to us in 90 days, and show us what the plan is to better protect our most vulnerable population.
And what specifically are you looking for? Is it because you don't trust what the prior administration put out thus far, and then what Hochul put up, you know, more data at the beginning, I think it was like August or September. Is it that you don't trust what's been put out, and you just want a revamp of the whole thing, or you think there's more information to come out?
Yeah, we need a deep dive, right, Senator?
The prior administration lied
have the information.
by 50% of the real number.
Yeah.
He wrote a book in the middle of all these deaths. He used his staff to write the book using our tax dollars. He got an Emmy, which he had to give back. I mean, my progressive friends really appreciate Hollywood. They took the Emmy back. They realized what went wrong. That in and of yourself says something smells bad. The fish is rotting. And we have to know what caused him to do all those things. If there was no problem with what he did, well, here are the numbers, and this is why I did everything what I did. But there's a lot of cover-up which took place. So, as Sue says, so I think we need to go deeper. And the family members, as she said, deserve it. I agree with that.
Yeah, they need closure. Right. Yeah.
When it comes to people across the aisle and in the other chamber, Ron Kim is one of the people who has been an outspoken ally of efforts of this kind. Where are the rest of the members of the chamber? I know it became popular in vote last year to call out the governor for various issues, but do you think, based on the fact that there are supermajorities, that an effort like this can actually gain momentum if there are more Ron Kims out there?
No, I don't know about, Ron Kim has been a huge advocate. I was with him in Brooklyn at a nursing home rally with people that lost their loved ones, and Ron Kim's been a great advocate. Every member in the state Senate has a copy of these bills, so the proof is in the pudding. Let's see what's going to happen, right? If they really care about seniors, then they would sign on to these bills and move them forward.
Have any of them actually talked to any of you about the measures in support or?
Well, let me say that
No.
this is not a Republican or Democratic thing.
No.
When Zucker came in, everybody chastised him, everybody grilled him. Assemblyman Kim is doing a bill with me. He had a press conference with me and Janice Dean saying he wants my bill and his bill for an outside, independent, bipartisan commission with subpoena power to do an investigation. I mean, that's a bill that's in print right now. Most of my members are on that bill here. He's a Republican, a Democrat, excuse me. I'm a Republican. They're all Republicans. There's some other members who are Democrats in there on the bill. So I'm surprised at the fact that the head of the health committees and my colleagues on the other side of the aisle here who grilled the commissioner said, okay, you wouldn't answer our questions, you lied about, there's a lawsuit, we had to listen to the AG, but that's all we want to know about it, and we're all done right now. That doesn't strike me as individuals who want to get to the bottom of what caused all this for the family members. Because other than that, they've been silent since the governor is gone. He's gone, so we don't want to worry about it anymore. Zucker's gone. Well, there's a future coming. And these things happen when we least expect them to happen, and we have to be prepared. So we really know the real answers. We really have to know the real answers to what took place.
Anybody else?
I just got one
Oh, sorry.
off-topic for Jim.
Okay.
What's up with St. Clair's? It's something that has been going on for 4 years at this point, almost. Do we have any positive or negative developments? Any questions on?
Thank you.